afternoon, everyone. Thank you so much for joining me. I'm here today with Dr. Mark Mallett, who's joining us virtually, and Sean Mahoney, who is here with me in person. Dr. Mallett is the immediate past president of the Manitoba Dental Association and a long-standing partner in delivering services to EIA recipients. And Dr. Mahoney is the executive director of Opportunities for Employment, a wonderful organization that provides free employment services to help people find meaningful employment. Thank you both for joining me at this important announcement today. And after my remarks, we'll hear from both of our guests and then be able to take your questions. As many of our recent investments and initiatives attest, our government remains committed to ensuring Manitobans continue to be supported and protected as part of our pandemic response. Despite increasing vaccination levels, vulnerable Manitobans still need our continued support and will continue to need supports when we emerge from this pandemic. That is why today I'm excited to announce that our government is partnering with the Manitoba Dental Association again to provide ongoing dental care for employment and income assistance recipients and children and youth in care. This is a 3-year agreement that is valued at approximately $32 million. Our government supports dentists to provide basic dental care to EIA recipients and children in care through a funding agreement with the Manitoba Dental Association, in which a portion of the costs are covered by the province. Under the Rewarding Work Health Plan, all EIA recipients who have found employment and no longer require income assistance are also eligible for up to 24 months of basic dental care to ensure lack of dental care is not a barrier for people and families exiting EI and achieving independence. The province is providing this new funding to extend the agreement for an additional 3 years to ensure ongoing access to dental care. Our government also recognizes that many people who rely on EIA need a helping hand to address some of the barriers that they may face to employment. We are committed to working with all Manitobans, whatever their barriers may be, and to help them get back on their own feet. So today, I'm pleased to announce we are supporting EIA recipients by creating a new $20 million endowment fund to help those receiving assistance overcome barriers to employment. Je suis donc heureux d'annoncer aujourd'hui que nous soutenons les bénéficiaires en créant un nouveau fonds de dotation de 20 millions de dollars pour aider ceux qui reçoivent de l'aide à surmonter les obstacles à l'emploi. This new endowment fund investment will be managed by the Winnipeg Foundation, and annual revenues from the fund will be distributed as grants to community partners and agencies to enhance training and assistance opportunities focused on aiding EIA recipients in finding employment and regaining independence. As a woman who was once on welfare, I know firsthand the importance of these benefits and programs such as these. Because of the programming that I was offered in 1988 as a teenage single mom on EIA, I was fortunate to find my way into the labor market to build a better life for my family. Today, I am pleased that this $20 million will guarantee programming such as the ones offered to me will be available for years to come. These programs could include wage subsidies, work placements, financial and wellness supports, culturally appropriate pre-employment programming, as well as the creation of unique partnerships with employers and community supports. Applications for these grants are expected to open in 2022, and we will use this time to consult with stakeholders, research existing grant and employment support programs in other jurisdictions, and develop evidence-based eligibility and selection criteria. This combined investment of more than $50 million will support enhanced quality of life in the long term for EIA recipients and children in care, and help to put employable Manitobans on a path to meaningful employment, dignity, and independence. I will now ask Mark to say a few words.
Thank you, Minister Squires, and also Dr. Mahoney for extending an invitation for me to take part in this important announcement. Oral health care is a critical basic health care need for all Manitobans. The Manitoba Dental Association is happy that the government has partnered with the dentists of Manitoba to ensure funding is available for dentist-led teams to provide care to recipients of employment and income assistance. This much-needed funding helps address issues related to Manitobans' access to basic dental treatment for children in care, as well as families and individuals experiencing low income. Canadians enjoy some of the most favorable oral health outcomes in the world, but access to basic dental care for people experiencing low income continues to be a challenge. Manitoba dentists have been working collaboratively with the government for many years to help in the efforts to improve outcomes for these more vulnerable groups. Les soins de santé bucco-dentaire constituent un besoin de soins de santé de base essentiel pour tous les Manitobans. L'Association dentaire du Manitoba est heureuse que le gouvernement ait été établi comme partenaire avec les dentistes du Manitoba pour s'assurer que des fonds sont disponibles pour que les équipes dirigées par les dentistes peuvent fournir des soins aux bénéficiaires de l'aide à l'emploi et aux revenus. Thank you, Minister Squires, for having me in, and I'll turn it back to you.
Thank you very much. We appreciate your words and ongoing dedication to supporting EIA recipients and children in care. And now I'd like to ask Sean to prepare to offer a few words.
Thank you, Minister Squires. It's good to be here today for such an important announcement. We had opportunities for employment. I've been working with income assistance recipients in the Department of Families since 1996, and together we've assisted thousands of people find and keep meaningful employment. As we exit this unprecedented time in our history, the economy is recovering, employers are hiring once again, and people are needing to get ready to get back to work. But imagine if you are a person receiving social assistance, a person who has lost their income and exhausted their savings, a person raised without means, a person never encouraged to be all that they could be, a person who's experienced many of one source of traumas or another, a newcomer or a refugee, even one of your neighbors or your family members. Many just need a hand up, not a handout. You can be trained in a short period of time for an in-demand job and walk into employment with your appropriate training. It is possible. For some, they require a resume, a cover letter, employability skills, retention skills, and a bit of encouragement and job lead, and they'll do fine. They honestly will. But for others who have experienced nothing but rejection in their lives, at OFE, we wonder if the day and age of a resume and a cover letter is antiquated, obsolete, and quite honestly inappropriate. What if we could introduce a person to an employer, tour a facility, and experience the in-demand job that is available today? See the workstation you're working at, meet the person you're working with, the person you're working for. And then the supervisor says, get trained up, I have a job waiting for you. To know that you have a job waiting for you, and all you have to do is get trained, is hope for a better future, for a job that's not out there somewhere, a better future that's waiting for you. And all you need to do is get trained. Self-esteem is built on how good you feel about yourself. Announcements like the basic dental health care is so important because a smile means so much and builds up your confidence and your self-esteem. Announcements like additional training so you can actually have something to offer to an employer, not only builds self-esteem but self-worth. No longer are you a person an employer has to accommodate for lack of skills or experience. You are their next best employee, but only if appropriate training, job-specific training for in-demand jobs happens today. On any given day at OFE, we have over 150 job leads waiting to be filled. Employers are hiring, and these days are having challenges finding people. Opportunity is knocking. Want to exit the world of social assistance and enter the world of self-sufficiency. These last few months, we've been encouraging our participants to get ahead of the wave of unemployment that is going to happen very soon as people return back to work. But they need to get in front of the line now. And how do you get in front of the line? In-demand training for in-demand jobs. Thank you, Minister Squires, for this announcement and for thinking ahead because the wave is coming. Thank you for your creativity with this funding model. To think that funds will be available for years to come as the endowment produces revenues, brilliant. And lastly, thank you for providing the opportunity for the people you and I serve. Training opportunities, especially for those receiving employment income assistance. Today's announcement will benefit our economy, will benefit the business owners, and will most of all benefit those receiving employment income assistance, the people that we serve. Everybody wins when everyone finds a meaningful job. Thank you.
Thank you so much for being here today, and thank you for your collaboration and service to the people of Manitoba. I would now be pleased to open it up to questions from the media if there are any.
Thank you, Minister. We begin our questions today with Josh from the Winnipeg Sun, and I will remind reporters one question, one follow-up, and it's helpful if you identify who your question is directed to. Josh, go ahead. Josh, are you there? Okay, we'll come back to Josh from CBC. Nick.
Hi there. Thanks for taking the time to speak with us today. I guess my first question is, in terms of the dental money, what exactly does that cover? Like you say, basic dental care, but could you give me a sense of what that is?
So we are wanting to ensure that all children in care and recipients on our EIA program have equitable access to dental care, as would any individual living in our society. And perhaps I'll have Dr. Mallet explain a little bit more as to what care we provide.
Thank you. While the EIA dental plan is basic and provides limited coverage, we're happy to see, obviously, no changes significant given the financial pressures faced by governments during the pandemic. The MDA partners with dentists, obviously, to provide that basic care to EIA recipients and children in care through a funding agreement with the government. And it covers 90% of costs associated with care, and dentists pick up the additional 10%. There are maximums on insurance, and of course, it does cover basics, but it is important for children in care and for adults to try to improve their outcomes to have access to that basic care.
Thank you. And my follow-up is, can you just give me a sense of, how important this kind of funding is, excuse me, how important the dental funding is for the children in care and the people on income assistance?
In recent years, the Manitoba dentists have taken a leadership role in the fight against the devastating effects of poverty on oral health of children and adults. And we work in a collaborative manner, mutually supporting the government programs so that we can better outcomes for patients. Oral health conditions are health conditions just like any other part of your body, and they can be devastating. Socioeconomics can, to some extent, affect outcomes and access to care. So for Manitobans to have access to care is a critical component of any healthcare, including your oral health care.
Thank you. Moving now to Marie at City TV.
Hi, everyone. Thank you for taking questions today. So for the first question, I guess this would be for Minister Squires. How many people do you plan or do you expect to be supporting through this program, specifically for the dental support?
So what we have in the province of Manitoba is an agreement that we fund all eligible applicants. So depending on the number of children that we have in care, we want all children in care to have good oral hygiene and good access to dentists so that they can have healthy teeth and beautiful smiles. We think that that's really important to establishing confidence as well as good health. And so as many children as we have in care are as many children who will have access to the program. Likewise, for EIA recipients, as many that we have in care are as many that have access to the program.
Thank you. And for my follow-up question, this would be for Sean. Maybe could you just give me a little bit more detail on some of the programs that you'd be looking to fund for the endowment fund? I know you mentioned culturally appropriate pre-employment programs, so just kind of getting a sense of what those might look like.
Well, quite honestly, I think any kind of training that you can provide for somebody that prepares them for a job that is actually available is so incredibly important. training up people for jobs that aren't available, that you have to search and find, especially with this people group, it becomes so precarious. The reality is that we all humans fear rejection, and anytime you can position somebody to walk into employment as quickly as possible, as efficiently as possible, and a good paying job, it benefits everybody. So as much as possible, programs will be put in place to help people be prepared for employment as quickly as possible.
Thank you. And now from the Winnipeg Free Press, our final reporter, Carol.
Hi, Minister Squires. I was just wondering, how much consultation was there with the federal government and your department or you about the funding for childcare prior to Monday's federal budget? Was there any, and do you have any meetings with Minister Carr set up?
Unfortunately, I do not. I did receive a phone call from Minister Huson on 2 days ago at 4 o'clock after the announcement was made to share with me the details of the announcement, and just to say that our officials would be connecting with further details.
And the federal government has said its priority is creating nonprofit childcare spaces, while Manitoba seems to be leaning more towards business, for-profit spaces. How much is Manitoba prepared to bend on that if the funding being offered is to create new nonprofit childcare spaces?
So I believe Manitoba has the second or the third lowest number of for-profits in our childcare system. We have 95% of our providers are in the nonprofit and 5 in the for-profit. When you look at the Quebec model, which the federal government itself has upheld as being potentially a universal childcare system to aspire towards, they use 20% of their service delivery through the for-profit model. And so I certainly don't think that there's any bending that needs to occur here in Manitoba. I think there's recognition that we do have a very robust childcare sector that ultimately just needs to have more funding in. That's why our government announced $25 million more since we took office into the childcare sector, and that is why Budget 21 announced 541 new spaces. We know we have a long way to go. We know that there are still parents looking for childcare, perhaps less so right now because we have the vacancies, nearly 5,000 vacancies because of the pandemic. But we know that there will be a rush of demand for spaces when this pandemic is over, and we're certainly hoping to be able to provide all those parents access to affordable childcare when they need it.
Thank you, Minister. Thank you to our participants, and thank you to the media. This concludes our briefing.
Thank you, everyone.